Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are exclusively designed for you. You can also connect with BCDA through the agency's multimedia platforms that include the agency's website, Facebook, the Time of Your Life Digest, Flickr, and Map, as well as an abundance of printed resources. For professionals, please consider viewing posts on LinkedIn for current programs and services to share with clients, residents, or patients, as well as BCDA's professional education opportunities. Connections to BCDA are stronger than ever, so please take advantage of the many options we offer. I would like to take this opportunity to wish our viewers a happy and healthy new year. Today's show focuses on starting 2025 strong with connections and resources. In the show, we will celebrate the production of our latest edition of the department's Community Resources Guide with Mary Wanthrop, Community Partnership Coordinator at the Department of Aging. We continue with Carrie Grafton, MAP Supervisor at the Baltimore County Department of Aging, who will explain all of the services available at the touch of your phone through Maryland Access Point or MAP of Baltimore County. Now let's start today's show by getting to know the Baltimore County Department of Aging's newly named director, Heng Tan. Heng, it is my pleasure to welcome you to the show.
I'm so happy to be here, Ethel. Thank you.
Having started as our director this past week, could you tell us a little about yourself and how you got into the field of aging?
Sure. Well, one, I wanted to say thanks for having me. This is my first week on the job, and it's really exciting to be able to talk to our listeners on this show. So, as I said, I have about 20 years of public health service, but really got into aging about a decade ago. I joined the Baltimore City Health Department as their deputy health officer to oversee their area agency on aging. In the city, the Department on Aging was housed right in the local health department. So I did a lot of alignment around public health and aging. But even before that, I have to say that my work began with working with Cambodian older adults and helping them navigate the healthcare systems. Aging has become personal and a purpose for me only because when I came to this country, my grandparents helped raise me up until I was 11 while my parents worked and went to school, and they were my primary caregivers for a long time. And when they needed to age in place and needed caregiving, I was their family caregiver. And so really got some perspective and insights around caregiving through that lens. But then after college, I came back home. And in Connecticut, of course, it was like the insurance capital of the world. And so I was either going to be an insurance broker, but I had the heart of a social worker. And I started volunteering at a nonprofit, helping people connect to fill out the census, actually, because it really mattered was um, who was counted in these numbers. And I realized that a lot of immigrant and refugees were really not counted in the census. And so volunteered part-time to work at Khmer Health Advocates. It was a community-based organization helping Cambodian refugees settled in their homes, and started that work there. I'm Cambodian, but I didn't know the language. When we came here, my parents and grandparents and families worked so hard learning English that I really lost my native language. And at that time, I think that the Cambodian elders taught me Cambodian again. And then I, in turn, helped them get to their doctor's appointments and really just navigate the really complex social and healthcare systems. And then built out a chronic disease program around diabetes. And so really started my work there. But I have to say that that the seed was developed by older adults, the Cambodian community really embracing me, teaching me what their needs are. And then I developed programs, chronic disease programs that I knew would work for the community. And so kind of that's where my passion stayed and laid. And of course, like I felt like because my grandparents had contributed so much to me, that was like this was something that I needed to continue to do. And I went on into doing some advocacy and communications work, and then later into government. And so I found myself in a role of being able to develop systems and craft policies to help older adults navigate in a meaningful way. And so that's kind of how I started in the field of aging and kind of really stayed in the field of aging.
What interested you in joining the Baltimore County Department of Aging?
So I moved to Baltimore about 9 years ago, and I've been a city resident. But just more recently, we moved to Baltimore County. My husband grew up in Parksville, and we just came back home to his home, and it just was a natural fit to join the Baltimore County team. I've always admired the Baltimore County's partnership when I was in the city. I've always admired the work in Baltimore County in terms of what the team has done. And so that really interested me because I knew that this was something that I can build upon and work upon. And there was a terrific team at Baltimore County because I was able to witness that as a partner in the city.
So, what are some of your first impressions of Baltimore County?
Well, it's been an interesting, really fast week. We've had some leadership transition at the county level, so we've really had to kind of prepare for that. But boy, it has been just so wonderful in terms of just being able to join this team. My first impression is that everyone here in the department is so knowledgeable and they're experts in the work that they do, which is it's just so wonderful to see because a lot of the times it is hard to find such passionate individuals. And so I could see that right away in terms of the people that I've met and the programs that I've seen within the short week. And so just such great impressions and such a great foundation to really, really work with.
I understand that you're very involved in policy and program development affecting older adults at the national level. Can you share the ways in which you've been involved?
Sure, I'm happy to share ways, but I feel like I have to kind of explain how some of the structure works and why it's important for local government to be involved in the national level. Our department receives funding under the Older Americans Act, which is a federal legislation that essentially gives funding to area agencies on aging to carry out their mission. There are about, I want to say, 600 area agencies on aging in the country, and there's a network called US Aging or Us Aging. It used to be called the National Association of Area Agencies on Aging, but they just recently changed and rebranded their name. I'm the first vice president of that board. I've been involved in their leadership for about 6 years. Really, really such a wonderful organization to be involved in and represent the third Mid-Atlantic region as the as a representative, first as the board meeting and then joining the executive team. I want to say 4 years ago. And so there, US Aging really is our advocate in DC at the national level. They advocate to preserve the Older Americans Act, to ask for more funding, to elevate the needs of the local communities at the national level. And so I have been involved in this national organization for 6 years and uplifting and elevating the needs of the local communities at the federal level. So my involvement has been just so wonderful, and I'm just so pleased to be able to continue to represent the Mid-Atlantic region in my capacity at Baltimore County.
I know you've just joined the department, but could you end by sharing what you believe your priorities will be for the department?
You know, I saw that question and I was like, a weekend, that's a tough one, a weekend. But I want to say that our mission is strong. It is really to help older adults age in place, connect people to resources, to be able to assist older adults of where they are in their journey, and then also to serve as their advocates of whatever their needs are. And so really, that's what I'm going to continue to do and to prioritize to do. I think there are some alignments around health and wellness that we could do. There's such wonderful programming that we currently do, and there's a lot of access points across the county. So really kind of building on what we currently do and looking at ways to collaborate and innovate are some of the things that I really am looking forward to doing.
Heng, thank you for taking time to join us on the show today.
Oh, thank you, Ethel. This has been really nice, and I'm so pleased to be here.
Probably one of many visits you'll have here.
Thanks.
We're going to take a short break, but first join approximately 8,000 mature adults who subscribe to BCDA's newspaper, The Time of Your Life Digest. Subscriptions are reasonable at $5 annually for Baltimore County residents over 60 years of age and $7 for under 60 who are Baltimore County residents or those residing in other counties. For information about becoming a subscriber, please call 410-887-3050.